April 2015. The air inside Hurley Medical Center in Flint, Michigan carries the familiar, sterile scent of antiseptic and latex gloves. For Dr. Mona Hanna-Attisha, director of the Pediatric Residency Program, it is a day like any other, a cascade of patient charts, consultations, and the quiet hum of a hospital at work. She sits at her desk, a stack of lab reports awaiting her review. These are not just papers, they are stories written in blood. Small windows into the health of the children she has dedicated her life to protecting. Her pen hovers over one particular report, a child's blood test. The number next to lead level makes her pause. It's high, not just slightly elevated, but alarmingly so. She frowns, making a note. An anomaly, perhaps. A child living in an old house with peeling lead paint, a common culprit. But then she sees another one, and another. A pattern begins to emerge from the data, a faint but terrifying signal in the noise of daily diagnostics. Something is terribly wrong. This feeling, a cold knot of dread in the pit of her stomach, is more than just a clinical observation. It's an echo of her own history. As an Iraqi-American immigrant whose family fled Saddam Hussein's dictatorship, she understands what it means when official narratives diverge from lived reality. She knows the scent of a lie dressed in bureaucratic language. Her work in public health is not just a job, it's a mission, rooted in the belief that every child, regardless of their zip code, deserves a chance to thrive. And lead, she knows, is a thief. It steals a child's potential, silently eroding IQ points, shortening attention spans, and predisposing them to a lifetime of challenges. It is a poison with no cure, only prevention. And the numbers on these pages suggest that in Flint, prevention has failed on a catastrophic scale. The city's story is one of managed decline, a casualty of deindustrialization and austerity. In April 2014, to save money, a state-appointed emergency manager switched the city's water source from the pristine, treated water of Lake Huron, supplied by the Detroit Water and Sewage Department, to the notoriously corrosive Flint River. The decision was heralded as a mark of fiscal prudence. Residents immediately noticed the difference. The water that flowed from their taps was brown, foul-smelling, and tasted of metal. They complained of rashes, hair loss, and stomach ailments. For 17 months, their cries were met with a wall of denial. Officials from the Michigan Department of Environmental Quality, or MDEQ, insisted the water was safe, that it met all federal standards. They sent out reassuring mailers, held town halls filled with platitudes, and dismissed the residents' legitimate fears as anecdotal hysteria. They were told to let the water run, that the discoloration was harmless sediment. They were told they were wrong about their own bodies, their own homes, their own children. Dr. Hanna-Attisha had heard these stories from her patients' parents. But it was a conversation with a friend, Elin Batanzo, a former water expert at the Environmental Protection Agency, that connected the dots. Elin had seen a leaked EPA memo about high lead levels in a Flint home and was horrified. She knew what happens when you pump corrosive river water through an aging infrastructure of lead and iron pipes without adding a crucial anti-corrosive agent like orthophosphate. It's basic chemistry. The corrosive water acts like a chemical solvent, leaching lead from the pipes and solder directly into the drinking water. She called Dr. Hanna-Attisha with a chilling question. Mona, is anyone checking the children? That question ignited a fire. Dr. Hanna-Attisha realized that if lead was in the water, it was getting into the bodies of her patients. The blood tests were no longer anomalies, they were confirmations. They were evidence of a citywide poisoning. Armed with this dawning, horrifying certainty, she did what any responsible physician would do. She tried to alert the authorities. She brought her preliminary observations to the Genesee County Health Department. She reached out to state officials at the Department of Health and Human Services, or DHHS. The response was not one of alarm or partnership. It was a cold, bureaucratic dismissal. They questioned her methodology, which at that point was still informal. They pointed to their own data, which they claimed showed no significant increase. They repeated the state's mantra, "The water is safe." It was a system closing ranks, protecting itself from a truth too damning to acknowledge. The very people tasked with protecting public health were actively working to suppress the evidence of a public health disaster. Her medical intuition, backed by science and the faces of the children in her clinic, screamed that a generation was being poisoned in real time. But who would believe a lone doctor against an entire state's denial? Following that chilling observation and the stone wall of official denial, Dr. Hanna-Attisha knew that intuition and anecdotal evidence would not be enough. To fight a system built on data, she needed her own irrefutable data. She was a pediatrician, not a research scientist, but the faces of her young patients, children who trusted her to keep them safe, compelled her to step outside the bounds of her job description. She decided to conduct a formal academic study. This was an act of scientific rebellion, a quiet declaration of war against the narrative of lies. She wasn't just practicing medicine anymore. She was seeking justice through the rigorous application of the scientific method. The first step was securing access to the necessary records. She approached the leadership at Hurley Medical Center, her professional home. It was a risk. Siding with her meant challenging the state, their primary regulator and a major source of funding. But the hospital, to its immense credit, stood by her. They granted her access to their electronic health records, a treasure trove of medical data stretching back years. With access secured, she assembled a small, dedicated team. Her key collaborator was Dr. Jenny LaChance, a public health researcher at Hurley. Together, they devised a simple but powerful methodology. They would become data archaeologists, digging into the digital records of thousands of children. They would compare blood lead levels for children under 5 years old in the period the water switch from January 2013 to September 2013 with the period the switch from January 2015 to September 2015. This before and after comparison would isolate the water switch as the key variable. It was a race against time. Every day that passed, more children were drinking the poisoned water. The work was grueling. For weeks, they spent their nights and weekends poring over spreadsheets, cleaning the data, and running statistical analyses, all while continuing their demanding day jobs. They meticulously geocoded the addresses to map the results, creating a visual representation of the crisis. As the numbers crunched, the picture that emerged was even more horrifying than she had feared. The blood lead level data was a smoking gun. Before the switch, 2.1% of Flint children had elevated blood lead levels. After the switch, that number had doubled to 4.0%. In specific high-risk neighborhoods, areas with older infrastructure and a higher density of children, the numbers were catastrophic, jumping from 4.9% to a staggering 10.6%. The data didn't just whisper, it screamed. The science was sound, the evidence was clear. Now came the most dangerous part, going public. On September 24, 2015, Dr. Hanna-Attisha stood at a podium in front of a room of journalists and community members and presented her findings. Her voice was steady, her message unequivocal. The city of Flint has a lead problem in its water, she stated, and the children are being impacted. She laid out the data, the maps, the science. She called for an immediate switch back to the Detroit water system. It was a moment of profound courage. She knew she was painting a target on her back. The state's response was immediate, coordinated, and vicious. It was a textbook case of institutional gaslighting. A spokesperson for the Michigan DHHS claimed their data didn't align with hers, suggesting she was misinterpreting the numbers. But the most venomous attack came from Brad Werfel, the communications director for the MDEQ. He publicly accused her of causing near hysteria and dismissed her work as that of an irresponsible researcher. The state issued formal statements and press releases designed to discredit her and her science. They attacked her credibility, not her data. They tried to frame her as a lone, emotional woman, an alarmist who was needlessly frightening people. The weight of the state was pressing down on her. The attacks triggered a crisis of confidence. She rechecked her numbers obsessively, plagued by the thought, what if they're right? What if I've made a terrible mistake? The personal toll was immense. She was a scientist, a doctor, and a public servant, and the very institutions she was meant to work with were now trying to destroy her reputation. With her career on the line, could her meticulous data alone force the powerful to admit their catastrophic error? The undeniable truth, meticulously gathered and bravely presented, could not be suppressed forever. While the state of Michigan waged a public relations war against a pediatrician, other forces were converging. In Virginia, Professor Mark Edwards, a water infrastructure expert from Virginia Tech and a MacArthur Genius Grant recipient, had been conducting his own independent testing in Flint at the urging of resident Leanne Walters, a mother who refused to believe her children were safe. His team's data on water chemistry perfectly corroborated Dr. Hanna-Attisha's data on human biology. He found dangerously high levels of lead in the water, confirming the mechanism of the poisoning she had identified in the children's blood. The two data sets, one from the pipes, one from the veins, formed an unassailable case. The state could dismiss a lone doctor, but they couldn't dismiss two independent, rigorous scientific studies that told the exact same story. This alliance of science, amplified by the relentless activism of Flint residents and the legal pressure from organizations like the ACLU, created an unstoppable wave of public outrage. National and international media descended on Flint. The story was no longer a local dispute, it was a national scandal. The pressure became too immense for the state to bear. The turning point came from within their own ranks. A state epidemiologist, scrutinizing the DHS data that had been used to rebut Dr. Hanna-Attisha, found that the state had, in fact, cherry-picked its numbers. When analyzed correctly, the state's own data confirmed her findings. The cover-up began to unravel. On October 2, 2015, in a stunning public reversal, officials from the DHHS held a press conference. They admitted that Dr. Hanna-Attisha had been right all along. Days later, Governor Rick Snyder announced that Flint would be reconnected to the Detroit water system. It was a monumental victory, but it was not the end of the fight. Admitting the problem was one thing, holding the powerful accountable was another. The months and years that followed saw a slow, agonizing crawl toward justice. State and federal emergencies were declared. Investigations were launched. A flood of lawsuits was filed on behalf of the poisoned children. The process revealed a deep rot of systemic failure, bureaucratic indifference, and environmental racism. Emails and internal documents showed that officials at the MDEQ and DHHS knew about the risks and the rising lead levels long before Dr. Hanna-Attisha went public, and they actively chose to hide the truth. Criminal charges, including involuntary manslaughter, were eventually filed against several state and local officials. But the path to true accountability has been fraught with legal maneuvers, dropped charges, and political deflection, leaving many Flint residents feeling that the system that poisoned them has yet to truly answer for its crimes. Dr. Mona Hanna-Attisha, the pediatrician they tried to silence, became a national hero. She testified before the United States Congress, her voice ringing with the moral clarity they had so sorely lacked. But she didn't just move on. She redoubled her commitment to the children of Flint. She founded the Pediatric Public Health Initiative, a partnership between Michigan State University and Hurley Children's Hospital. It's a model program designed to mitigate the long-term health and developmental effects of the lead exposure through nutrition, education, and healthcare access. She turned her righteous anger into a lifetime of constructive action. The story of Flint is not just about corroded pipes and lead poisoning. It is a story about the failure of democracy, about how austerity policies can have life and death consequences, and about how environmental injustice disproportionately harms poor communities of color. It is a stark reminder that the most dangerous threats to our health are often not diseases, but decisions made in boardrooms and government offices far removed from the people they affect. Dr. Hanna-Attisha's legacy is a testament to the profound power of a single, courageous voice, rooted in scientific integrity and moral conviction, to challenge an entire system and demand a better world. Her story forces us to ask a deeply uncomfortable question. How many more Flints are waiting to be uncovered, and who among us will have the courage?